jumping ahead, I kind of forced you to jump ahead. But getting back, you said concussion is a mild traumatic brain injury, and you said it can sometimes be a little difficult to diagnose. Like I think when it's obvious, but sometimes it's a little more subtle. Unfortunately, there's not like a cheek swab or some biomarker that we can just check to prove someone's had a concussion. But essentially, if someone's had a head injury and they're having new symptoms that, fit into one of these buckets, like Paul said, headache, sleep, cognitive, or emotional, that can be it. It's obvious when someone like is dazed after they hit their head or has like some like a little bit of amnesia after they hit their head that it was a concussion. But that often is not the case, fortunately. For the patient, it's fortunate that they're not that dazed or concussed. But they may have some of these other symptoms, and if they start within a day or so of hitting their head, then you can call it a concussion and you can treat it as such. And this graded activity, she gave us this 2-point rule. I think it's really practical and easy to follow. And I even asked her about looking at cell phones, and she said, yeah, I mean, they can follow the 2-point rule with that. She's like, you can basically apply it to your whole life. If your pain's at a 2 of 10, headache's at a 2 of 10, and you start looking at your cell phone, and it goes to a 5 out of 10, that's more than 2. So you got to go back, chill out and try again later and just spend less time looking at your phone.